Okay. And the criteria is that if the patient has had more than or equal to 3 infections of UTI in just 1 year, or more than or equal to 2 UTI infections in the last 6 months, then we would classify that as a recurrent UTI. And in this case, they would give them prophylactic antibiotics to prevent future UTIs. Any questions so far? Okay. Okay. The next one is infective endocarditis. Okay. Infective endocarditis. So this is the definition is the inflammation of the heart valve. Infective endocarditis means inflammation of the heart valve. Typically, it's caused by an infection. Most commonly, it's going to be Staphylococcus species or streptococcal species. Remember, both of them are gram positives. The most common valve that is infected is going to be the mitral valve, which is the valve on the left heart. Okay, on the left side of the heart. I always draw the heart as a square with the left and the right side. This is the mitral valve. This is the tricuspid valve. When does the tricuspid valve become infected? This one becomes infected in patients who have a past medical history of IV drug abuse. In that case, it's going to be a younger patient, and the pathogens are going to be Staphylococcus aureus, Pseudomonas, or Candida. These are the pathogens that you would suspect in that scenario. Okay. What are the risk factors to acquire infective endocarditis? Okay. Rheumatic heart disease, IV drug use, immunosuppression, prosthetic heart valve, and a congenital heart disease. Like ASD, atrial septal defect, ventricular septal defect, mitral valve prolapse. Okay, tetralogy of Fallot is another one. The prosthetic heart valve endocarditis, this usually happens after a dental procedure. Okay. So let's go into acute endocarditis. Acute endocarditis. Acute endocarditis is a type of,
I'm sorry, I have a question. How does the prosthetic heart valve and dental procedures go together?
yeah. So I think I talked about it. So basically, what happens is that after a dental procedure, so a patient who has had a prosthetic heart valve placed in, like let's say most commonly it's going to be a aortic valve replacement surgery, and then they go to the dentist, and then during the dental procedure, let's say they do a tooth extraction, there's some type of a cut that happens in the mouth, and then through that cut, what happens is that the bacteria that's part of the normal flora in the oral cavity goes through that little cut, and then the first place it's going to go to and form a biofilm is the prosthetic aortic valve, causing infective endocarditis. And that's why the most common organisms in that case are going to be pathogens or bacteria from the oral flora. That's how it happens. That's why it's the clinical practice is that based on the American Cardiology Association, they recommend that patients who have had a prosthetic heart valve to take antibiotics like amoxicillin 24 hours before any dental procedure. That's how it happens. Good question. Very good question. So does that answer the question?
Thank you.
Yep. So acute endocarditis. Acute endocarditis is a very it's a short. It happens suddenly, and once it happens, it progresses very fast unless you jump on it right away. Okay, so that's acute endocarditis. The most common causes of acute endocarditis are going to be Streptococcus pneumoniae and Streptococcus pyogenes. Streptococcus pyogenes. Okay. If the patient is a IV drug user, then the cause of acute endocarditis is going to be Staph aureus. Okay. Now there's another subtype called subacute bacterial endocarditis. This is the type that progresses very slowly because the signs and symptoms are not very very noticeable.